Now we're going to talk about transmission and pathogenesis of parasitic infections. I'm Dr. Manal Salahuddin, Professor of Medical Parasitology. Pathogenesis of parasitic disease depends on 2 points: the host tissue damage by the parasite and the immune response by the host. Both form the clinical picture of a parasitic infection. The degree of host tissue damage and the degree of immune response differs between people. So we can get an asymptomatic parasitic infection or symptomatic parasitic infections with symptoms and signs. Symptomatic parasitic infections are due to systemic effects or local effects of parasite on the human host. We're going to talk first about the systemic effects of parasite on host and the resulting clinical findings. First, the circulating excretory products or metabolites or antigens or even toxins of the parasite or even disintegration of the parasite will release foreign proteins. These foreign proteins will lead to allergy and toxemia, clinically manifested as fever, urticaria, rash, and up to bronchial asthma. Then number 2, we have the release of, if this condition occurs suddenly in large amount, massive parasite antigens are released in the circulation, it will lead to anaphylaxis, and clinically it will lead to anaphylactic shock. Then we have depriving nourishment from the host. These parasites, they take from the host, take nourishment from the host himself, eating his food, okay, resulting in malnutrition up to malabsorption syndrome, and clinically there will be physical growth retardation, mental growth retardation, weight loss, and hypoproteinemia with edema. Number 4, from the systemic effects of parasite on host, we have decreased deformation of RBC from the bone marrow, or increased RBC destruction, result of its being parasitized, or decreased hemoglobin, or even loss of blood. All of these factors will lead to anemia by its different types of anemia, either hemorrhagic, iron deficiency anemia, vitamin B12 deficiency anemia, or even hemolytic anemia. Clinically manifested as pallor. As you see this figure, these two hands, one is showing anemia, the other is normal, the reddish one is normal. And then we have eosinophility and lack of concentration. The last point is increasing the number of eosinophils in blood or tissue, which is named eosinophilia. And this is a characteristic feature of hematologic infections. And eosinophils, of course, they are responsible for pathological lesions, and they are present in large number in inflammatory lesions, especially with hematologic infections. Then we have the local effects of parasite on the host and the resulting clinical findings. We might find mechanical obstruction. For example, if the adult worms are in large number, or they are they are very long in the gastrointestinal tract, they can lead to intestinal obstruction, appendicitis, or even pancreatitis. Also, if the lymphatic vessels can be obstructed by adult wounds, leading clinically to lymphedema of the lower limbs, as you can see in this figure. Then we have number 2, pressure symptoms. The parasite can form a space-occupying lesion, and this depends on its site, whether it's in the liver, in the lung, in the brain. According to its site, it will cause destruction of the original organ parenchyma, and so it affects its function. Okay. Then we have number 3, the damage or irritation of intestinal epithelium. The presence of the worm or protozoa itself, its presence in the GIT, in the gastrointestinal tract, will decrease the intestinal absorptive surface. Okay. Besides, their feeding on the host intestinal epithelium and secretion of proteolytic enzymes will lead to destroying the intestinal tissue and disturb physiological process. Clinically, there will be diarrhea, bloody mucus diarrhea, indigestion, malabsorption, ulcers, and dysentery. And finally, there is it can affect the skin locally, leading to skin nodules, ulceration, or even dermatitis. Answer this question, please. The immune status of the host does not affect parasitic infection outcome. True or false? False. All parasitic infections are symptomatic. True or false? False. Thank you.